Bismillahirrahmanirrahim. We are going to start the chapter number 2 of Robbins, that is inflammation and repair. Inflammation is defined as a complex reaction to injurious agents such as microbes and damaged, usually necrotic cells that consist of vascular response, migration, and activation of leukocytes and systemic response. Basically, we say that inflammation is a protective response and it involves the host cells, blood vessels, and proteins and other mediators that is intended to eliminate the initial cause of cell injury as well as the necrotic cells and tissue resulting from the original insult and to initiate the process of repair. Although inflammation helps to clear the infection and other noxious stimuli and initiate the repair, the inflammatory reaction and the subsequent repair process can themselves cause harm. First, let us discuss that how inflammation is a protective response. Inflammation tends to eliminate the initial cause of injury. It initiates the process of repair, helps to clear infections and noxious stimuli, and bring the molecules of host defense to site of injury. As I said, inflammation can also be harmful. Let's talk about the common examples of how inflammation can be harmful. For example, in rheumatoid arthritis, atherosclerosis, lung fibrosis, a life-threatening reaction to insect bites, drugs, and toxins. Inflammation is normally controlled and self-limited. It is activated only in response to injurious stimuli and it is short-lived. After that, it is degraded or become inactive as the injurious agent is eliminated. In addition, various anti-inflammatory mechanisms become active, and you must remember it that if the injurious agent cannot be quickly eliminated, as a result, there will be chronic inflammation. Okay, let's discuss this picture. With red color, it is shown that infection, injury, obesity, and diabetes can lead to inflammation, while inflammation can lead to metabolic syndrome, arthritis, Alzheimer's disease, asthma, allergies, ulcerative colitis, inflammatory bowel disease, colon, breast, and lung cancers, joint pain, eye disorder, cardiovascular disease, and gingivitis. Okay, let's talk about the cardinal signs of acute inflammation. The external manifestation of inflammation, often called its cardinal signs, are heat, that is called calor, redness called rubor, swelling, that is tumor, pain, dolor, and loss of function, that is functionalesia. The first four of these were described more than 2000 years ago by a Roman encyclopedist named Celsus, who wrote the famous book Text de Medicina, and the fifth was added in the last 19th century by Rudolf Virchow. Let's discuss the first four. In the picture, it is clearly described that when harmful things enter the body, it leads to pain, warmth, swelling, and redness. These are the external manifestation of inflammation. Okay, here is a funny representation of cardinal signs of acute inflammation. Heat, redness, swelling, and pain. They were discovered by Celsius, and loss of function was given by Rudolf Virchow, known as father of modern pathology, and he gave this in 1902. So hope this funny diagram can make you memorize it easily. Let's move ahead. Inflammation is induced by chemical mediators that are produced by host cell in response to injurious stimuli. Mediators are of two types, cell-derived mediators and plasma protein-derived. Examples include the histamine, serotonin, prostaglandin. Histamine comes in amines. Its source is mast cell, and not only mast cell, histamine source is also basophil and platelets. It causes vasodilation, increases the vascular permeability, and endothelial activation. Serotonin source is platelet. Function is vasoconstriction. Prostaglandin source is mast cell and leukocyte and causes the vasodilation, pain, and fever. If you discuss the extra cell-derived mediators that are not mentioned here, it would include the leukotrienes, reactive oxygen species, nitric oxide, platelet activating factor, cytokines that will include the tumor necrosis factor, interleukin 1, interleukin 6, and chemokines. They will be discussed separately in mediators video, inshallah. Okay, let's move toward the plasma protein drive. Examples include complement, kinin, and protease activated during coagulation. Complement sources plasma while it causes vasodilation. Kinin sources also plasma, it also causes vasodilation. And protease activated during coagulation sources plasma while it causes endothelial activation and leukocyte recruitment. Once we are done with mediators, let's move toward the types of inflammation. It can be acute, it can be chronic. Acute onset is first minute or hours, while chronic is slow and occur in days. Cellular infiltrate in acute is mainly neutrophil, while in chronic it is monocyte, macrophages, and lymphocytes. In acute inflammation, the tissue injury or fibrosis is usually mild and self-limited, while it is severe and progressive in chronic inflammation. The local signs and systemic signs are prominent in acute inflammation, while when you see in chronic inflammation, they are less prominent. Acute inflammation respond rapidly and deliver the leukocyte and plasma protein to site of injury. They are of having the two major components, vascular changes and cellular events. In vascular changes, there is vasodilation, increased vascular permeability, and addition and migration of leukocyte through the vessel wall. Cellular events include the immigration of leukocyte from the circulation and accumulation in the focus of injury, that is called cellular recruitment. It is followed by activation of leukocytes, so it enables them to eliminate the offending agent. Important point that you should remember in cellular event that I have already discussed, that the principal leukocytes in acute inflammation are neutrophils, that is polymorphonuclear leukocyte. Let's talk about the chronic inflammation. Over here I have written granulomatous inflammation. What do you mean by this? It is a distinctive pattern of chronic inflammation, and it is characterized by activated macrophages and scattered lymphocyte. Its examples include tuberculosis, leprosy, syphilis, and sarcoidosis. Okay, two other examples that include the cat scratch disease and Crohn's disease. Okay, mostly there comes a short question that mention the chronic inflammation, granulomatous inflammation examples, so you should learn them. And this is the picture of sarcoidosis. Okay, this figure is taken from Robin, and let's discuss it. As we are done with the types of inflammation and mediator, so let's discuss this diagram now. You can see there is a vessel and it is having endothelium along with its basement membrane, and you can also see in its smooth muscle is there. Now what happened inside the vessel, you can see polymorphonuclear leukocyte. So they are the neutrophils, that is the principal leukocytes in acute inflammation, and their function is that they are concerned with elimination of microbes in dead tissue. Then plasma proteins are there, we have discussed it, complement system is there, and clotting factor and kininogens are there. Then with plasma protein, you can see the lymphocyte, they show the immune response. Monocytes are there, they will develop into macrophage and will do the elimination of microbes dead tissue. They are also the source of mediators, that is cytokines and other, and role in immune response. Then platelets are there. The endothelium will be source of mediators, for example nitric oxide, cytokines and other. Okay, this lymphocyte we have discussed. Mast cell are also the source of mediator, for example histamine. Okay, one thing is left. Below the diagram you can see fibroblasts are shown over there, and with fibroblast extracellular matrix protein and cells are written. So these extracellular matrix protein and cell, they will help in the repair of the cell. So that is all about the introduction of inflammation. We will discuss the full chapter in detail inshallah. Allah Hafiz.